Hello, I'm Dr. David Hornbrook. I've had the opportunity to work with thousands of dentists just like you over the last 15 years. And one question keeps coming up because of the confusion, I think, in our industry, and that's about splint therapy. I mean, there's so many types of splints out there. I mean, when do we prescribe one? When don't we? What are the indications? What are the contraindications? You know, I'm a simple thinker. I want you to be able to go back to your office, look at your patient, and understand what to prescribe and how to do it efficiently and predictably. The one I'm going to focus on is what we call the NTI, which is really an anterior midpoint stop appliance, where as the patient bites down into the splint, they're only hitting in the front of the mouth. This is an example of this anterior midpoint stop appliance. This is an NTI. Now the NTI stands for nociceptive trigeminal inhibition. It reduces the ability to clench as hard as they would if they could hit on all their teeth or a traditional full arch splint where all the teeth contact. Most temporomandibular disorders have one causative factor in common, and that's basically excessive motor activity of the trigeminal nerve, which is a result of the teeth occluding or excessive occluding of the teeth. The NTI, like this, by moving the contact anteriorly, that's why we call it an anterior midline stop appliance, reduces basically the clenching activity, the muscle activity of the temporalis by about 75 to 80%. So when our patients are clenchers, our primary clenchers, and I'm one of those, when they clench into this, they cannot clench, that's the intensity, as forceful as if they're occluding on their natural teeth or if they're occluding into a full covered balanced splint. Now the advantage of this NTI, and this is an NTI plus, it's made out of a very non-porous hypoallergenic acrylic, which will not discolor with time. NTIs can be made chairside. I prefer a laboratory to make them, and I design and I prescribe the NTI plus. The fact that it doesn't just attach to 2 or 4 teeth, we don't have as much stress on those teeth, and especially if we have existing restorations such as porcelain veneers where we have a lot of porcelain and we don't want that much force as the patient is pulling it in and out. It's very comfortable, as you can see. It doesn't cover all the teeth, so it's not as obtrusive as a lot of our full coverage splints that our patients will not wear. With the NTI Plus, what they've done is we have a very hard acrylic on the biting surface, and then they use a thermoplastic material on the inside. Now the advantage of that, we can actually put it in hot water and it'll actually allow us to modify the internal aspect of this splint. It doesn't make it soft and rubbery, but what it will do, it'll make it so it'll adapt around the teeth a little better. Now even at home, they can put it in hot water for about 30 to 45 seconds, put it back into their mouth, and it'll adapt around the teeth, either getting looser, more comfortable, or it'll actually tighten and adapt better around their existing dentition. So what are the indications of an NTI Plus over a traditional full coverage splint? First of all, we utilize it with primary clenchers. Those are individuals that clench at night. The second are those individuals that clench and brux. What we see is when they clench, we're going to see less contraction of the muscles that are responsible for a lot of our TMD, and there'll be less stimulation of the trigeminal nerve. What are our goals with this type of appliance? The first is to, as I mentioned, eliminate any posterior tooth contact in centric as well as any lateral excursive movements. We want to prohibit any posterior teeth contact. Lastly, we want to eliminate contact of our canines during any lateral intrusive movement. And as we design this DE, as you can see, as the patient goes side to side, we want to make sure that we design this or adjust it if need be, and we'll talk about that, so that as the patient goes through lateral movement, they do not enlist their canine tip. Because as soon as you bring the canine into play, the temporalis starts firing.